Welcome to Aster Hospital, a beacon of hope, healing, and innovation nestled in the heart of Parklands, Nairobi. In a world where healthcare is constantly evolving, Aster Hospital stands at the forefront, combining modern medical technology with compassionate care. From the moment you walk through its doors, you're not just a patient, you're family. Established with the mission to provide affordable, world-class healthcare, Aster Hospital offers a wide range of services, from outpatient consultations and diagnostics to complex surgeries and emergency care. Its team of skilled doctors, nurses, and support staff work tirelessly around the clock, guided by a simple yet powerful commitment to serve with integrity, excellence, and empathy. Behind every successful procedure and every healed patient is a story. Whether it's the pediatric ward filled with young laughter or the advanced surgical suite saving lives daily, every corner of Aster Hospital tells a story of care. The hospital is also deeply embedded in the local community, offering health education, outreach programs, and screenings that extend beyond its walls. Because true health begins not just with treatment, but with awareness, prevention, and empowerment. As Nairobi continues to grow, Aster Hospital remains a vital pillar in the city's healthcare landscape, shaping the future of medicine one patient at a time. This is Aster Hospital, a place of healing, a place of hope.
My name is Caesar. Who am I here with today?
You're here with Dr. Mercy.
Dr. Mercy, nice to meet you. So I have a question for you. What motivated you to specialize in this field?
Okay. So I thrive in high pressured and environments. Yeah.
Wow, that's amazing. So due to the fast-paced, high-pressure environment of this field, how do you then manage with stress and to avoid burnout?
You delegate your duties, take a break. Yeah.
Okay, amazing. So could you tell us personally, what is the most enjoyable and the least enjoyable part of your job?
My most enjoyable part of my job is you see when a patient come to the accident and emergency, those are the first crucial moments of a patient. So the first moments of saving lives, give me a good satisfaction.
Wow,
yeah,
that's amazing. And the least enjoyable?
The least enjoyable is maybe when you lose a patient. Yeah.
So you understand. And lastly, to top it all off, what advice would you give to a young person aspiring to specialize in your field?
So working in the accident and emergency is really a good working place, since you get to learn a lot. You deal with the unexpected. So maybe be swift, critical thinking. Yeah.
That's amazing. Thank you. Thank you for all your help and all your service. We really appreciate you.
My name is Dr. Sandeep Sharma. I'm a consultant physician and I specialize in internal medicine. I got motivated to come in healthcare because this is a noble profession, and so there are so many people, those who are needy and in case of their health issues. So it is better to help them to lead a better life. The day-to-day is busy and hectic. It starts early in the morning till the evening hours. We have OPDs, outpatients, inpatients we need to serve for, and there are some procedures. Even in the middle of the night, we can get an emergency call and we have to attend the patient. I think the public has grown their knowledge in terms of education, finances, travel. But healthcare is one domain where people need to be more aware, educated, so they can manage their own health. And it should be a top priority, especially even in the education period, through schools, colleges, and as they grow. There is a case which has impacted my life. A patient had come with weakness on one side of the body, and we successfully diagnosed him as an acute stroke. He came in time, so we had the best treatment available for him. We gave him the medication to dissolve the clot, and within few minutes the patient started moving their hand and their legs. So it is important to approach a healthcare facility in time, which can reduce the morbidity, and people or patients can lead a better life. Thank you.
My name is Joan Simbi. I'm the Deputy Chief Nurse at Aster Hospital. I decided to become a nurse, or rather chose the career path of nursing, because I was motivated. Growing up, I used to love the way the people around me would take care of people. When you do community service, the way we take care of the elderly people, the people who are in need. So that's when my vision or desire to become a nurse started growing in me. So eventually, when I had the opportunity, I decided to become a nurse, so I could also have an opportunity now to take care of people now by the skills that I get to learn in school at a more professional level. Working in healthcare in a busy hospital can be very hectic sometimes, and especially when you're in a management position, you have people working under you. It can be really hectic, managing people, taking care of patients. And so in such situations, what really helps me to stay composed, to stay grounded, to manage such situation is, number one, getting composure. You just, I always ensure that in a very busy or a very hectic scenario or cases, I need to make sure I am, number one, composed. I organize myself, and then I display that confidence. Because the team that I worked with, when you're leading people, the moment you're confident, even your team will be able to get that confidence, and then we are able to manage whatever situation that presents itself. It also gives our patients and our clients the confidence in us. They're able to see that we know what we are doing, and by that we're able to gain their trust. So it's really helpful. Balancing work, professionalism, and being human. I always say that number one, I am human, then I am a nurse, second. So what guides this, that enables me separate these two sometimes, is now when we look at professionalism, we are guided by core principles. We are guided by the hospital's or the institution vision. For example, you're expected to be ethical. You're expected to uphold some levels of integrity. You are supposed to have some level of accountability. So when I am a nurse, when I am at work, those are some of the principles that guide me. And now on the other side, now when I am now human, I put my professionalism aside. I look at people the way they are. I don't see somebody like, now you need my help. Now I look at you in the context of a patient or anything. I just look at you now as a person, as a human being, and now work aside. And now when I focus on those two areas, at least it's able to, I'm able to differentiate my professionalism and the human part of me. And that one has also helped me a lot now when I'm interacting with now colleagues outside of work, my other friends, my family. So yes, that one has helped me a lot. Ever since I started working, or since I became a nurse, what has really changed in how I see people is I have been able to build more on my listening skills. I tend to listen more. I want to understand this person. In nursing, one of our core values is empathy. You try to fit in that person's shoes. You try to understand how they feel. And you can only be able to do that if you listen more. So you better understand them, you see where they come from, and that way you'll be able to assist them. So I think for me, listening more has really helped me change how I see people in that perspective. If someone would shadow me for a day, say 24 hours, one thing that will really shock them is my how do I put it, my patience, the way my tolerance level. I am very patient, I am very tolerant. And you see, sometimes in our field, sometimes you just need work done. You need patients to be taken care of. You need zero tolerance on patients complain. Sometimes you don't have that time to really try and sit with a colleague. They probably made a mistake or they didn't do something right. Sitting with them, trying to understand them. When you're so busy, you might not have that patience. But one thing about me, I think I am very patient, I am very tolerant, I'm very understanding. So I believe that one can really shock so many people. Thank you.
Hello. How is everyone here doing? Welcome to Aster Health Care Pharmacy, where our motto is to strive for excellence in healthcare management. As an Aster Pharmacy, let me first start introducing my team. We have my superintendent here, that is Fauzia. I have my other team members there, Mr. Andrew, who, as you can see, is busy billing patients, and I have other staff members. Now, the beauty of Aster Healthcare Pharmacy is we are very, very personal-based pharmacy. We treat each and every person as a VIP. Each and every person gets the same treatment as any person who walks in here. For us, our patients are our biggest source of joy. Unlike other pharmacies, we take interest in our patients. We interact with them, which our people here can attest to. Now, the pharmacy role in the hospital. As I can say, the pharmacy is the backbone in a hospital. Because without the pharmacy, I'm sorry to say, your doctors can do nothing. So as a hospital pharmacy, running a hospital pharmacy comes with a lot of challenges. We need to make sure that we are up to date with the latest molecules in the market. We need to be up to date with our DDAs. We need to be up to date with all our documentation and everything. My superintendent here is very particular about the DDAs, and we run a very tight ship when it comes to those kind of medications which can be abused. So that I assure you, so that is a very big challenge if you look into a hospital pharmacy, maintaining the DDAs, and because we also have a OT which is running in parallel. So it's a challenge, but that is what we are here for meeting the expectations and rising above the challenges. And when you ask about the role the pharmacy plays, it's not just about dispensing the medications. It's about looking into the patient, understanding the patient's medications, and then coordinating with the doctors and the nurses so that the patient gets his best medical care. We also do ward rounds, not just with the doctors. We also do some individual private ward rounds just so that we get to know how the hospital pharmacy can improve. And apart from only catering to people in the hospital as an inpatient pharmacy, we do have an outpatient pharmacy also, which is open 24/7, 365 days, come rain, come shine. We are here to serve you. And at Aster, our motto is strive for excellence. So even if a medication is not available at the moment, we make sure we deliver so that our patient doesn't miss out on any of his doses. Now, the question that you, my friend, had asked me is, what is the problem and the challenge that we face in terms of inventory and in terms of monitoring the medications? I do not find any challenge in inventory because I believe that when you step into the kitchen, you're supposed to be ready for the fire. So as such, there is no challenge in inventory management. But yes, like I said before, and I reiterate, we do sometimes face challenges with DDA medication and antibiotics because people feel like it's just Panadol, so why don't I get it? So explaining to them about all that is a bit of a work, especially for those people who feel they're Google doctors. So it's a bit of a challenge, but we manage. Every day is a learning curve for the pharmacy. And like I said, it's a hospital pharmacy, so the inpatients are we are more interested in, and we make sure they're comfortable at all points of time. So what we do is, once the patient is inside the ward, we check up on the medications and make sure all the medications are being given on time, and we coordinate with the doctors, we coordinate with the nurses, we talk to the nurse, learn and get ourselves educated. If something is missing, then we find out how soon the patient can get it. So we try and source and do the best patient medical care that we can offer at Aster Health Care.
Jambo everyone, I am Dr. Rachna, consultant gynecologist at Aster Health Care, Medi Plaza, Nairobi. Today I am going to give a small talk about my work, what I do, how I feel, the whole day, how I spend in my hospital. For me, the typical day for me as a gynecologist, a typical day is when I come to my hospital in the morning and I am towards my chamber. I see in the waiting area some of the gynec patients, some of the pregnant patients who have come for their antenatal checkup, some of the gynec patients who have come with some gynec issues, some menstrual issues, some discharge issues, which when I step in my OPD, these are the things which go in my mind, that I have to see all these patients. Once the patients come inside the chamber, I just talk with them softly, nicely. I ask their good name so that they get ensured that I am safe. I am in some safe hands. And being a gynecologist, they have some sensitive points and complaints to talk with or share with me. They are comfortable. Once they are comfortable, then they start coming up with their problems. There are many problems which they come upon, like the baby is not moving, maybe I am having a lot of nausea, vomiting. I need to ask them. I am not getting sleep at night because of the baby's kick. I am having bad discharge and all those things, which slowly and steadily I try to understand, and then after doing that, I explain them. I note down all the history. After that, I explain them that this is the way, the procedure which I am going to do, or the examination which I am going to do for them. For gynec, because I am going to, for gynec patients, because I am going to do the private part examination, they are a bit shy, they are not comfortable. So I need to explain them that it won't be a painful procedure. I will use most of the anesthetic gel so that they would be comfortable. And once they are cooperative, I will get most of the information, and I will finally reach to the proper diagnosis. After that, once I see the patient, I give them tests, and then accordingly I give them the treatment. But these patients nowadays, they are very good in their knowledge about the problems they are with. Because of the technology, because of the paraclinical education, because of the awareness, they know many things about what they are going through. Like if patient comes with one complaint, they know maybe the diagnosis will be 1, 2, 3. So I am the one who to solve their problems, that no, you don't fit in 1, 2, 3. You fit only in the first diagnosis, because these are the symptoms, and this can be the best treatment for you. Bringing a small life, helping the woman to bring a small life in this world is the most happiest part, I feel. Many gynec problems, like maybe cancer or maybe infections, which when cured, patient is so relieved, and seeing them relieved along with their family members, that my mom is the most healthiest person, because I think the house is run only by the females in the house. Everything is so well managed by females, and females are the most neglected person in the whole community. So I feel when they become better and healthier, they can serve the community better. This is the only thing which motivates me to take care of females and their reproductive health. Thank you very much.
We are trying to boost the capacity of our patient in terms of providing affordable quality care. And whenever we are thinking about hospital, our main aim to leave, main aim is to leave behind a legacy of compassionate, high quality care, fostering a community of well-being and positive impact on lives of patient and our staff. So I think this is something I wanted to convey to our community through your medium. Thank you so much.